Welcome back. One of my favorite organizations that gets results for the community is Hope and Help.
And the Health Center provides treatment and resources for people living with HIV. And later this month, they're counting the steps as a way to further the mission.
So to share the mission with us, joining us today about the Hope and Health AIDS Walk is Lisa Barr, the Executive Director of Hope and Help, and the Community Director, Josh Myers. Good morning to both of you. Thank you so much for joining us.
Thank you so much for having us.
So what's this event all about?
Go ahead, Mr.
Well,
Events.
AIDS Walk Orlando has
Mr. Events.
AIDS Walk Orlando has been around for a long time, since 1995, and it's our opportunity to raise awareness about HIV in Orlando and all the different resources that are at people's disposal to prevent developing HIV. And so we're going to have a great time at Lake Eola Park. We have a couple hundred people walking and celebrating all those who are living with HIV and really having a great time with our folks.
And you mentioned all of those resources. I mean, for people who haven't been to Hope and Help, I mean, there is so much going on and so many resources available. You know, the health clinic. Tell folks who might not know.
Yeah, we are a full service organization now, so anyone who needs services from primary care to HIV specialty care. We also do HRT for people who are transitioning, transgender community. And we also have the wraparound services. So we do case management. We have a prevention team that hopefully helps people not get HIV because it is a preventable disease. So a lot of education, a lot of outreach. We test over 5,000 people annually to make sure that they're knowing their status, because that is the most important thing, is if you are HIV positive, to get into care very soon and to stay into care.
And, you know, this is not like it was in the 80s.
Oh, absolutely.
I mean, the treatment options and everything has evolved so much, and one of your missions is to remove the stigma.
Absolutely, absolutely. It's, you know, no one asks you, may I take your cholesterol readings and may I check your sugar levels? So the stigma around HIV, it is a long-term chronic disease. It is no longer a death sentence. People do die from complications related to AIDS, but it is not something, if they're in care, that will happen soon. So someone who's diagnosed today can live a long, healthy life as long as they're in care. And that's the key to everything that we're doing.
Absolutely.
And how many people does Hope and Help help throughout the year?
Say that again.
I know, that was a toughie one, yeah.
Well, we service thousands of folks between the testing and outreach that we do at community colleges, health fairs, and other organizations. And then there's also the folks that come see us in our medical clinic that have become patients of Hope and Help. So we're sitting around a couple thousand folks, and we're encouraging them to spread the word about the services that they're getting at Hope and Help. And also with our campaign that we have going on, it's called Choose to Protect. And there are 4 main tenets. We're encouraging everyone to, number 1, talk about safer sex, to talk about your experience with HIV. We're encouraging everyone to get tested, and we're encouraging people to use condoms often as possible, and also to learn about PrEP, which is a medication that is one of the many tools in our arsenal of fighting against HIV, but it's a medication that you take daily, and it will help you reduce your chances of contracting HIV by up to 92%.
Wow.
Oh, wow.
And there has been some
Absolutely.
exciting science with some of these people that have been part of studies, and they've basically cured them. What's happening with that, or how have you been excited by some of that news?
Well, the goal with anyone who's living with HIV is to get them to an undetectable level. And with that, and when you are undetectable, that means that you have a 0% chance of transmitting HIV to someone else. So once you get to that undetectable level, you're at your body's most optimum health. And that's where we want people to get to.
And so for folks who want to come out and get involved in AIDS Walk, it is very celebratory. Will your mobile testing unit be out there as well?
We'll
An
have
AIDS
some
Walk?
partners that will provide Hep C testing and
Okay.
HIV testing.
Okay, and so all the information right there. Saturday, April 27th. Be there by 7:30. Do we have to walk the 2 laps? We have to walk 2 laps, right?
Yes.
I know Troy and I got in trouble one year because we dropped out and went to the restaurant right afterwards.
That's what happens when it's in the morning.
Oh yes.
But speaking of, what's this?
You got something in your bag.
We do. One of the things that we are just starting, and you are actually our very first awardee, is the Executive Director Circle Award.
Aw.
And what we
You're gonna
ca-
make my eyes water.
what we
And that never
count on,
happens.
what we count on is you have done such an incredible
Aw.
job in assisting us in getting the word out. Because by just talking about it this morning, we are helping to reduce stigma. You know, anyone who has a sexual encounter is at risk.
Absolutely.
And unless you are very aware of your status and your partner's status, you know, it's that important. So the stigma, there are very few people in the world who have never had sex at least one time. So know your status, get tested, get in care if you're infected, get on PrEP if you're not, and you are a frequent participant. So we wanted to thank you for
Aw, that's so
assisting
nice.
us in getting the word out. So
Aw, thank you so
are
much.
our
I love it.
inaugural first awardee.
Thank you.
So thank
That's
you.
so awesome. Thank you guys
Thank you.
for being here.